skin deformities and check for symmetry. After doing that, I'll palpate. I palpate along the spine and just palpate for any deformities I may feel. Can you breathe in? And then I would feel for symmetrical expansion. Can you say 99?
99.
And again?
99.
And upon doing that as well, with the palpation, I would inspect for any tenderness. Then I will go through and percuss the lungs. And then I will auscultate to listen to our breath sounds. Can you breathe in? Again. Again. On this side. And one last time. Alright, so with that I didn't hear any adventitious lung sounds at all. And then I will move forward and inspect her anterior chest. First I would just look to see for any deformities. After that I will palpate. Do you have any tenderness?
No.
Can you breathe in for me? And again, inspecting for symmetrical lung expansion. Can you say 99?
99.
Perfect. Now we'll percuss the lungs on the anterior side. Okay, and then again, auscultating the lungs to listen for lung sounds. Breathe in. Alright, so everything checked out there. Now I'll assess the range of motion in her upper extremities. Can you do this with your hands and arms out and behind your head? And then I'll inspect her upper extremities just to look for skin color, hair distribution, and temperature, and just look for any abnormalities. Alright, you can go ahead and lay down. From here, I will go forward and listen to her heart. In doing so, I will listen for any extra heart sounds. I will identify S1 and S2 and her PMI. And then I would have her roll to her left side and do the same thing again. Then I would move forward and inspect her abdomen. I would first inspect for contour, symmetry, look at her belly button and hair distribution. After doing so, then I would auscultate her bowel sounds. Just noting to make sure that I hear them every 3 seconds or so. After that, I would percuss her abdomen. And then I would do light palpation. Any tenderness?
Nope.
And And then I move and go on for deep palpation to assess for more internal organs. Any pain with this?
Nope.
Okay. And then I would inspect her lower extremities, looking for hair distribution, symmetry, any lesions that are abnormal, as well as feeling for temperature. Can you bend your knee? And then I would palpate her palpatile pulse. This way. Then I would look at her posterior tibial pulse. And I would find the pulse on the top of her foot. And I would do that with both legs. And then I would have her remove her socks and look in between her toes for any skin lesions. After doing that, I would also palpate for edema, which is not present. And then I will do range of motion with her legs. Can you lift your legs straight off the bed? And the other leg? Can you bring your knee towards your chest? Perfect. Can you point your toes? Flex them. Can you scrunch your toes? Perfect. Can you bring your right leg to your left leg on your shin and slide your heel down? And do it with the other leg? Perfect. Then I'll have you sit up on the edge of the bed again. From here, I will move forward with the neurologic assessment. I will have you close your eyes, and I will have you tell me if it's light or soft touch, okay? That one's sharp, this one's soft, okay? So I'll be doing that, and you'll just tell me which one you feel.
Sharp. Light. I don't know. Sharp. Light. Sharp.
Okay. After that, I would assess light touch. Close your eyes and just tell me when you feel contact on your skin.
Okay. I feel it. Feel it. I feel it.
Okay. After that, I would assess with vibration with the tuning fork. After doing that, I'll take her hand and I'll have you close your eyes, and you'll just tell me whether I'm pointing your finger downward or upward, okay?
Down. Down. Up. Up. Down. Up.
Perfect. Alright. I'm going to have you close your eyes and recognize the object that I put in your hands, okay?
It's glasses.
Okay. So, that was good. And then I'll have you test your rapid alternating movement. Can you start with your hands like this on your thighs? And flip them. And then keep going and get faster each time. And faster. Perfect. From there, I would move forward and test her reflexes. With the reflex hammer, which I do not have, I would test her biceps, triceps, her brachioradialis, her quadriceps, Achilles, and then use the bottom of the hammer to test her plantar reflex. Okay. And then from there, I'll have you stand up and face the wall. I would inspect her legs for varicose veins. Can you bend forward? And I would palpate her spine again just to make sure everything's in alignment. Right. Can you walk to the wall for me? Then turn around and walk heel to toe back. Okay. And then can you walk on your tiptoes back to the wall? And then on your heels back to me again. Alright, can you close your eyes and stand? Okay. And then I'll have you stand on one leg and bend your knee. And then the other leg. Alright. And then can you lean backwards? And then side to side. And then twist. Alright. So that would conclude my head to toe assessment. I would share any findings that I had with the patient and answer any questions that they had from there on out.